So welcome everybody to today's seminar. As I said, we're going to be talking about the new HESA care experience data flag. And we've got a really good panel here to take you through some of the details of the new data flag. But before we get down to the specifics of that, I'm delighted to welcome Dr. Neil Harrison, Deputy Director of the Rees Centre at the University of Oxford. And Neil is going to give us a contextual overview to get the webinar underway about why these changes are important and how they will benefit both practitioners in universities, obviously care experience students themselves, and also the research agenda. So we'll hand over to Neil in a moment, and I will do welcomes for all of the other speakers as we go through. We will have a Q&A panel at the end, and as well as the presenters for today, we will be joined for the Q&A also by Nicola Turner from UCAS. Okay, so if we could move on then, Neil, if you would like to make your introductory comments. Over to you. Thank you.
Thank you, Patricia, and thank you everyone for joining us this afternoon. My name is Neil Harrison. I'm Deputy Director of the Rees Centre at the University of Oxford, as it says on the screen there. The Rees Centre is a specialist research centre that specialises in work around educational outcomes for children in and around the care system, and importantly in this context also for adults who are care experienced. And so the reason that I'm doing this sort of introduction is that I've sort of come into this, if you like, as a data user, and so the data that is collected through the UCAS flag, through institutions and then through onto HESA. I have done a series of pieces of research looking at that data, and I think I'm one of the first people to have done so in a sort of systematic and national sort of way. And one of the things that came to light when I started doing that a couple of years ago is that actually there's a lot of variability in practice across the sector. The data itself is not very strong, not very robust, as we would term it, because the practices within individual universities and colleges are very different in terms of the way in which that data flag was being used. And also because sort of follow-on work from that sort of unearthed that actually there were lots of different understandings about care experience within universities, about what it meant, what the different flags, what the different categories were meant to mean, and so on. And what that meant was that the data as it was standing was not actually being fit for purpose. And what it meant was there were lots of false positives. So there were people being recorded as being care experienced who weren't, and vice versa. People who were care experienced who are not being recorded appropriately. Now that causes, if you like, three problems. One is for people like me, researchers, and hopefully we provide a sort of useful task for everybody on this call in terms of highlighting what is happening in terms of access, participation and success for care experienced students. And of course, we want to provide the best research possible so that you can understand better about those pathways, how to support students and so on. But also it's really important for practitioners and for universities to make sure they've got the right information, to look at numbers, to understand how outreach activities are working for that group, and to be able to monitor things like degree outcomes, graduate employment and so on. And of course, if the categorizations are wrong, then the research, the monitoring and so on is going to be wrong as well. And we've also become aware over the course of time of students themselves missing out on things like bursaries or other opportunities because of the way in which the data about them had been recorded, either through the UCAS form process or indeed through the institutions themselves. So I think it's in everyone's interest, and as Patricia just said, that we get this right. It is a complex area. Care is not straightforward. There are different legislative frameworks working in the 4 nations of the UK. There are different circumstances over time. So somebody who's care experienced in their 40s and 50s going into higher education will have had a very different experience to those who are in sort of 18, 19 or 20. Even in a sense, the types of care that people have come through have changed. So there's been a shift, for example, away from using children's homes, residential settings, as was the case predominantly in the 70s and 80s, to more use of foster care and kinship care. And so we need to try to capture all of that background information so that we're able to get the practice right and to get the policy making right as well. And so that's the end of my little scene setting. So thank you all for coming along. You're all sort of doing me a favour as well in the long run by making sure the data I look at a few years down the line is as good as it can be. But as I say, I think it's also helping yourself and your colleagues and your students in the shorter term as well. So thank you very much for the chance just to start off there, Patricia.
Great, thank you very much, Neil. That's a really helpful overview of the context before we get on to the detail of the changes. So if we could move on now then, please. I'm delighted to welcome Rachel Wright, Senior Policy Officer at the Office for Students, who will take us through some of the sort of policy background around how the new data flag definitions were developed and what benefits they will bring. So Rachel, very happy to hand over to you now, please.
Thanks, Patricia. Can everybody hear me? Yeah. Okay. So as Patricia said, I'm Rachel. I'm from the Office for Students. I'm in the Access, Inclusion and Skills Directorate, and I sit within the Access and Participation Regulation team. So I work on broader regulatory activity, but also on effective practice work with a particular remit and interest in care experience student policy. So in my presentation, I'm hoping to give a quick overview of how the new HESA field changes sit within the broader context of OFS work. But I'll also provide a brief overview of what the changes to the new HESA field are and how it links in with other data sources. So as Patricia said, there will be chance for questions at the end of all the presentations. I'll be happy to take them then. Next slide, please, Moira. Okay, so Neil's touched on why we've been developing the new HESA field, but I just wanted to summarise and say that this is about improving the data picture so that providers can identify and record a broader range of students who've experienced being in care and ultimately provide better support for those students. And I should emphasise that this development is the outcome of some really collaborative working between OFS and HESA, but with considerable input from NNECL, in particular Neil with his research and data expertise, and Aaron, who's not here today, but from a practitioner's point of view. And also the public HESA consultation and a provider forum discussion they've been really helpful in terms of taking this forward. So just to set out why this is important for the OFS in particular. So we know that care experienced students do have significantly poorer educational outcomes than the general population on average. And as such, they are a priority group for the OFS. So on this slide here, we've set out some of the tools that we use to improve outcomes for this group. So care experienced students are one of the key groups that we want providers to focus on in their access and participation plans. I think most of you will know what they are, but for those who don't, they are access and participation plans are where providers set out their commitment to closing equality gaps. Our guidance from government, which is the framework behind this, Regulatory Notice 1, includes care leavers as an underrepresented group and sets out how all universities and colleges must include a consideration of care leavers across the student life cycle in their plans. So this is our kind of regulatory tool. In terms of access and participation effective practice work, this is about establishing and sharing best practice to give providers the tools that they need to deliver on the commitments that they've set out in their plans. So this means for us keeping abreast of research, policy, data developments, engaging with stakeholders and providers, and creating and updating information sources and signposting to information sources such as web pages, blogs and briefings. And in this case, actually taking forward a piece of work which we think would not have been possibly achieved through regulation on its own. The consistent offer of support is a piece of work around testing models for a more consistent offer to care experienced students, potentially in some pilot areas across the country. So looking at IAG, financial and pastoral support and accommodation, and more clarity about admissions. So last winter, we commissioned a feasibility study to look at what the existing offer was and what the opportunities and the challenges might be to establishing a more consistent offer. And NNECL actually undertook that work. So the recommendations from that have been massively helpful. And interesting, one of the key things that came out of that was around definitions and the complexity and how that was making it difficult for providers to offer a kind of consistent offer. So we're taking these recommendations forward. We're working with our new director, which I'll touch on in a minute, and with the board to consider how we take that work forward. But the changes to the HESA flag really underpins that work, because we'll be able to better understand what works and what kind of difference that might be making in different localities. So just to go back to quickly, we do have at the OFS a new director for access and participation. His name is John Blake, and he started with us just a few weeks ago at the start of January. So he is in the process of speaking to colleagues and working with the board to set out a new APP strategy. So we do have one of those on the horizon, and I don't know what changes that will mean for the more regulatory elements of our work, but the changes to the HESA flag are already underway. And what we do know is that the strengthening of the data picture will inform and underpin whatever approach we do decide to take going forward. Okay, next slide, please, Moira. Okay, so in terms of the data, one of the queries that we've had quite frequently since initially discussing these proposals is around how the relationship between the HESA flag and the UCAS flag. So I just wanted to try and clarify that as best I could. So the UCAS tick box is where care experienced students are encouraged to tick this at the initial application stage on their UCAS application to say that they've spent some time in care. And ticking that box means that universities and colleges can identify applicants at the pre-entry stage and connect them to the right support. However, there isn't any verification at this process at this stage. So in addition, the field does slightly differ at the UCAS stage from the HESA stage because the UCAS flag actually includes kinship care and asks about time spent in care, which the HESA flag now does not. I'll go on to talk about that. So all that information is useful contextual information for the provider, but it's not intended to be interpreted directly into a tick on the HESA flag. So at the admission stage, when the student starts at the university, universities and colleges will therefore need to talk to their applicants during that admission stage to determine the student status. So the HESA category that best aligns to their circumstances. So to identify what support they already receive and assess what additional help they might need to participate successfully during their time in higher education. So I think Patricia's going to go on a bit later to talk about what that conversation might look like and types of evidence and verification, what that might be required. But there are tools and organisations that can also assist with that. So I've mentioned here about the student journey, and that was really just to iterate that the HESA record follows students throughout their HE journey. So as a result, providers will be able to track retention, success and progression data for these students. So this exercise will also help universities and colleges to better evaluate the effectiveness of specific interventions. So including financial support, for example, for specific subsets of groups who have experienced care. Okay, next slide, please, Moira. So I was just going to briefly talk through the new definitions. I'm expecting that most of you will have had a chance to have a look at these. So these are in the HESA coding manual. And what we've done is we've broken these what was the existing care leaver flag into some subcategories, so to differentiate between formally recognised care leavers and those who have experienced care but who are not supported by their local authority. So this top level category is broadly similar to the previous care leaver category in that it aims to capture those students who receive or who are eligible to receive statutory support. So we purposely haven't referenced 16th birthdays or time spent in care, as the statutory definition could potentially be subject to change, and we wanted to ensure that these records were sensitive to such changes. Next slide, please. So this is the second definition, and this category aims to pick up anyone with care experience who falls outside of the previous category, so that code 06. So this would be picking up mature students or those who might have dipped in and out of care or not been in care at the point of their 16th birthday, so they're not captured through that statutory definition. And this group is important to understand, as they might actually require more in the way of certain types of support, as they don't receive anything through the local authority. Next slide, please. So this is code 8. This is self-declared care experience, but not confirmed. So this was deemed important to capture these students, as it would pick up those who flagged as being in care at the UCAS stage, but who may have not chosen to disclose at the admissions at the HESA stage, or for whom appropriate evidence was not accessible. So we think it'd be helpful to understand what is happening with this group. And lastly, 09, no experience of care. This would pick up the vast majority of students, but will also include some false positives. So those who might have flagged as having been in care at the UCAS stage, but were then deemed by the provider as perhaps having mistakenly ticked the box at the UCAS stage. So this is those who might have ticked that because they were a carer, or they might have resided in boarding schools, but also the students that I referred to earlier who perhaps might have been in kinship care, which doesn't count as local authority care for the purposes of the HESA flag, although we would still ask providers to consider the individual needs of such students with regards to support. So next slide, please. This is something that my colleague Will produced quite quickly on request, just as a visual aid to help people to understand that code 6, 7 and 8, the aim here is so that we could amalgamate these three codes to show a broader care experience journey if we wanted to. Obviously it's helpful for us to have these split up, so that we can understand what's happening within the individual subgroups. But basically any of these three codes here are picking up students that that are very likely to have been in care. And then we have code 09 in the orange box, no experience of care, and 98 and 99 are for those who prefer not to say or who are unknown. So the benefits here, one of the main benefits is so that on a national and at provider level, we can look at the individual subgroups to understand trends, data patterns, but also impact of interventions on different groups. Okay, next slide, please. So just to highlight some further information or sources that you might find useful. So what I can share this slide after this session so that you can use the links, but essentially the top one is the new the coding manual care leaver field. We've got links to the UCAS student support pages, which talks about why students, encouraging students to tick the box, basically. The Care Leavers Association are able to assist students and practitioners in terms of that conversation with a student about evidence in their kind of care experience. I've also put the link into our topic briefing, which is on our effective practice pages that you also might find helpful, with some more signposting on there. So just finally, just to say that my colleague Will and I are both around after the presentation. So Will works in data and analysis, so he understands more of the technical background than I do. So we're both around to answer any questions if you've got any queries, but if we can't, we'll definitely pick them up after the session. Thank you. Thanks, Patricia.
Thanks very much, Rachel. That was really helpful overview of OFS thinking and policy drivers. And yeah, we'll come back to the questions at the end of the session. Moving on now, I'm afraid you're going to have to listen to me for a bit because sadly our chair, Aaron Pyle, wasn't able to come today. But I'm going to talk about the decision tree which we have on the NNECL website, which is designed to help institutions when they're going through that process of determining which of those subcategories a student might fit into and what kinds of verification or evidence they might need to determine that. So if we could go on to the next slide, please. So firstly, a big thank you to Neil, who, as well as giving us the overview at the beginning of the session today, also worked on the decision tree for us. Greatly appreciate that. As I've said, the aim is to provide this for practitioners as a useful tool to help in reviewing the different fields and the evidence required. There will, of course, be a few instances where there's something highly individual where you may need to seek further guidance. And there are also a small number of adopted people who are not adopted from care and that they would therefore not be regarded as care experienced. So, for example, where they've been adopted by a step parent or a sibling. What I'm going to do now is briefly just take you through the questions on the decision tree. I'm afraid it doesn't look as pretty as the document on the website, but hopefully it will give you a flavour of the questions and the different answers and the kinds of evidence. So the first question very much picks up on the statutory definition of a care leaver. So is this person recognised under the Children Leaving Care Act? And if the answer is yes, then they are a care leaver. And the kinds of evidence you would be looking for would be a letter from a local authority to confirm that. If they have a personal advisor or a local authority bursary, then obviously that is indicative evidence that they fit into that particular category. If the answer is no, then let's go on to the next question. So for this question, was the person recognised by their local authority as a care leaver in the past? And if the answer to that is yes, they would fit under the care experienced subcategory. And this may be particularly relevant for more mature students who have aged out of the care leaver status, and they should be able to get a letter from the local authority to confirm that. And in some instances may find they can resume their care leaver status. If the answer is no, then let's move on to the next question. Were you adopted from care or left care with a special guardianship order? So a person who answers yes to that category would be care experienced, and their parents or carers ought to be able to provide a copy of the adoption order or special guardianship order or some similar documentation. If the answer is no, then we move on again to the next question. So, did the person spend time in foster care or a residential home as a child? So if the answer there is yes, then again, we're looking at somebody who is care experienced. Those who are sort of younger should hopefully fairly easily be able to get confirmation of that, a letter from a social worker, foster carer, or residential home manager. A letter from another professional would also be something that you might think was sufficient to evidence that. If the answer is no, again, we move on to the next question, which is actually two questions really. So it's going back to the point about kinship care, but it's asking, did the person spend time in kinship care as a child? But a supplementary question, was that then recognised and supported by their local authority? So if a person answers yes to both of those questions, they do fit under the care experienced category, as this is formal kinship care. And again, students should be able to get a letter from their local authority or potentially from another professional that would confirm this. If they were in kinship care but not recognised and supported by the local authority, then this is informal kinship care. And this wouldn't normally be considered as care experienced, although individual universities and colleges may still wish to provide some support for this. And again, you'd be looking for an explanatory letter. You wouldn't necessarily categorise them as care experienced under the HESA flag, but you might still want to provide some support for them as a group of students. So if we move on again, if the answer was no to both kinship care and whether it was supported by the local authority, then the next question is around, did the person enter care at 16 or 17 and they were housed in semi-independent housing? And this could include people who were formerly homeless or unaccompanied asylum-seeking young people. And so again, the answer is yes, they would fit under the care experienced subcategory. And again, those students should be able to get a letter from a social worker or other professional, either in the local authority or potentially a teacher, doctor or solicitor might be able to provide that. If the answer is no, then no, they are not care experienced. If we could go on to the final slide from me, this just gives you a link to the resource on the NNECL website. And again, you will be sent these slides afterwards, so you'll be able to click through to this resource link. Again, very happy to answer questions about this in the Q&A, and we also would welcome any feedback that people have on the decision tree, and if there are any other categories or issues that we think we should try to capture within it. Okay, thank you very much for that. If we can now move on again, please, Moira, and I'll resume my role as chair and just say that we're also delighted to welcome today Rachel Wilkes, Collections Development Manager from HESA, who is going to give us again a bit more of the background in terms of HESA's role in collecting this data and the process behind that. So Rachel, over to you, please.
Thank you very much for that introduction. Yes, so my name is Rachel Wilkes. I work at HESA, and I just thought I would start my slides by giving everyone a quick overview of who HESA are, because I think some of you will be close to HESA and some of you probably won't be. So just to help bring everyone onto the same page of that. So yeah, who is HESA? Who am I talking about? We are actually a charitable company, but we're operating under a statutory framework on behalf of funding councils and UK government departments. We are a part of the UK statistics family, and we produce official statistics. A sign that a number of our statistical outputs have met a very rigorous quality threshold. So these outputs are regulated by the UK Statistics Authority, which has a direct line of accountability to Parliament, independent of any government department. So as part of this need, as well as the English providers having a condition of registration, Welsh, Scottish and Northern Ireland providers, the memorandums of assurance with their respective funding councils, all HE providers are required to return accurate and timely data to HESA. So it's part of our job then to ensure that the process of that data collection and the analysis of that produces data of the highest quality for everyone to use. So moving on to the next slide, why were we kind of set up? HESA was originally kind of founded between an agreement with higher education funding councils at the time, higher education providers, and the relevant government departments. So the Further and Higher Education Act 1992 and the White Paper Higher Education, a New Framework, identified a need for this more aligned and a coordinated approach to higher education, statistics and information. And that's where HESA was founded from. So this is a part of our mission, or HESA's kind of mission, is to support the advancement of UK higher education by collecting, analysing and disseminating that accurate and comprehensive statistical information to respond to all kinds of needs across the sector. So this little diagram just kind of explains a little bit more where that's kind of coming through. So if we click through to the slide, so basically higher education providers kind of produce and collate the data for the various returns and send it across to us. We have then lots of queries, so a lot of our data quality validation kind of goes back and forth between HESA and the providers to kind of get that up to the high quality data as we can. HESA then disseminate that out to our statutory customers for use and also for data analysis by our various customers. And so from the funding councils and the regulators, that funding goes back then through providers because they use that data on the basis of any calculations and things that they do for funding. So on the next slide, just in case anyone wasn't aware, I've quickly listed all of the different statutory customers who feed into the different data sources we collect. So in terms of the outputs, we've got a range of different things, it's kind of statistical bulletins, open data that's published on our website, various other things, so Heidi Plus that providers themselves can use, the Discover Uni website, which kind of run through OFS, and we feed the data in, the HESA data into the end of that. There are all kinds of different ranges of use of that. We've got, I've got a figure here, if it's around 1,200 inquiries annually across our data ranges, the data is always supplied under contract for specific uses. And there are a few high profile data requests in there. So a lot of different people use the HESA data. In terms of which providers we are serving, so the subscribers we have, so on my last count, I think it was almost 450 providers we've got across the UK, and the graph kind of there shows roughly where the split are. And I think as we'd expect, there are a lot more in England, but we are represented across the UK. So in terms of the different records, so today we're focusing on the student data, which is right in the middle there, but we do have a lot of other collections as well. So this diagram kind of shows how some of those data items link in, and I think particularly here, what is relevant, talking about the kind of care leaver and the uses, the onward uses of that data, the student record data feeds into graduate outcomes, and actually some of that, not the care leaver bit, but some of it feeds into the Unistats website as well, which is now Discover Uni. I've just realised that name is out of date. I will rename that for the next one. So a lot of them are kind of linked in terms of counts or some of the data items that are there. But it means that we can follow students through on their journey, follow a student through in their graduate outcomes survey, and then things like that. So that's all the different data items that we collect, and a quick overview about who HESA actually are. So on to the consultation itself. So we actually ran quite a large consultation. It was a personal characteristics and equality data consultation, it was called, at the beginning of last year. Which on the next slide, Maury, if that's all right, we published it in the middle of March, and we kept it open for 3 months, so it closed in the middle of June. We received 117 responses, as it says there, from higher education providers and a couple of other organisations as well. And we went through all of those responses and announced what the changes were going to be in September. So focusing just on the care leaver bit, that was one part of that. There was about 12 to 15 other items that we were consulting on. And what we were trying to do in that is actually consult across our records to make everything kind of aligned. But the care leaver data is just in the student record, which will now feed into data futures for 22-23. So that's the consultation itself. In terms of the questions we were asking, with all this work that's been going on with NNECL and with OFS and others to develop some of these questions and the categories of data they wanted to collect, the questions we were trying to ask in the consultation is to kind of propose that and understand from providers what the burden was going to be on the change of that and whether they supported those changes to be made. So these are the questions we asked, whether they supported it. A general burden assessment score is what we call it, and then a further comments box in case there was anything else people wanted to add. So in terms of what we actually changed, I found this diagram quite helpful when we were particularly looking at changes across HESA fields, because it kind of shows you a little bit about what we're actually changing in terms of codes. So code 1 and code 4, you can see there, are both disappearing. Codes 2, 3 and 5 are all staying as they are, because those are the codes that Scotland are using, providers in Scotland are using. And then we've got our new codes, so 6, 7, 8, 9 there. And then we've got some generic codes. So the whole consultation was actually doing a bit of a review of those bottom 3 generic codes anyway. So the care leaver flag was kind of doing the same thing that we'd implemented across the others. So standardizing the code, standardizing the labels, and making sure all the fields had them in there where it was appropriate to do that. So we went through that. That was the changes, and we made the announcement of changes. I have put the link at the very top of there just in case anyone hasn't seen the page, but I've done a screenshot of what the table is there. So you can see the 3 at the top that are still in for providers in Scotland, and then these 4 that are now in for England, Wales and Northern Ireland, and the 3 generic codes at the bottom that are for everybody. What we try to do when going through the consultation responses is we try to pick out any questions that providers often ask us. So there are certain things that are always come up when HESA want to change data items, and student records, the continuing students is always the top question. So what we tried to do when we made the announcement was actually answer some of these questions straight away, so that providers could kind of get started with their making their changes if they wanted to. So continuing students, they didn't need to be resurveyed. The care leaver field sits on the entry profile. So actually, for those of you who are in the data submission, well, no, you don't have to send that every single time. Once you've sent it the first time, we kind of keep hold of that data and reuse it. So that's always the question. You didn't need to do that this time. We would hold that data as in the old format, and that was fine. Yeah, so there's the data model roughly kind of showing where it fits. There's a lot of other fields around there, but that was kind of just showing where it is. If providers needed to send it again, they could resurvey if they wanted to, but there really wasn't a requirement to do that. And right at the end, I've just put the HESA website as well, just in case anyone isn't familiar with HESA and wanted to read up a little bit more about it. That is a link to our website. And I think that is all my slides. Yeah.
Great, thank you very much, Rachel, for that overview. That was really helpful as well. We're going to move on now to the panel Q&A. We've got about just under 20 minutes left for this. And we do have a number of questions that have already come up in the chat. So we'll start to work through those. I'm hoping that Nikki Turner's here from UCAS, who's also going to join us from the panel. And I think Neil is also unfortunately going to have to leave us pretty much now because he has another appointment. But we'll get underway with the questions. There's several about the decision tree and the evidence verification process. One of those around, do we have to confirm, could we confirm that whether institutions have to physically see or request evidence from a student, or can a conversation take place to say, you know, that the institution is reasonably happy that the person is care experienced? And I think I'd be interested in comments from other people on the panel on this, but my take on it would be, if you're making some kind of financial award to the student, you would probably want to see some kind of verification. But I think for an institution who is offering other kinds of pastoral support for care experienced students, but not necessarily a bursary, you may be happy to have that conversation with the student and decide on the basis of that they are categorised as care experienced. But I don't know, Rachel Wright, if you've got any comments or thoughts on that.
Hi, yeah, thanks, Patricia. I was just going to add actually that I saw that there were a number of questions coming up on that. And one was also around whether a telephone conversation would suffice. suffice in terms of verification. We have the actual the definitions on the coding manual have purposely been left fairly broad so as not to do, you know, it's up to a provider how they choose to verify who their students are. We can't specify how that's done. So I think what we've said in both of those top two fields is around having reason above and beyond the information given on the form. So I think I would just agree with you, Patricia, that it's down to the provider to determine the status of their students, and that might vary depending on you know, what is linked in, whether there is financial support attached. So yeah, I'd agree with you there, I think.
Okay, thanks, Rachel. We've got a few questions around differences in terms of the definitions and the way that data is captured in Scotland compared to the rest of the UK. And particularly there's a question here about kinship care and that being captured more inclusively within the Scotland Scottish environment. So the other Rachel, HESA Rachel, I don't know if you want to comment on the differences between Scotland and the rest of the UK, and also what you think that might mean for any kind of aggregation of data across the UK.
Yeah, so we have this in a couple of fields, and I think care leaver is actually one of the kind of starkest examples of that. You know, sometimes there are cases where the definitions across the UK have to be different because of the purpose of what our data is being used for, you know, funding and for regulation purposes. Then sometimes we have to match what that, you know, that, so in this case in Scotland, what those definitions are in Scotland, and they may well be different to the rest of the UK. But if they were tried to be aligned, sometimes that means that it then couldn't be used for what it needs to be used in Scotland. So we did have definite discussions with Scotland at the time when this was all happening to see whether they wanted to join the others, and they had to stick with the definitions they have. So what happens with cases with data like this where there are different definitions, I think what we try to do is, if anyone was to ask for this data, make sure that they understand that there is definitions on the website to look at that, make sure they understand that there is a difference, and that's why. So that in Scotland they would be using those 3 codes, and for England, Wales and Northern Ireland they'd be using the other 4. I think what tends to happen is it means some things get aggregated. So like in OFS's diagram, there was the little circle that brings in code 6, 7 and 8, wasn't it, together. I suspect something similar would happen in Scotland. So you could attempt to get something comparable, but it is a different definition. And so it does mean we end up in situations like that. And that's how we tend to handle it at HESA, is just make sure people are aware that that is different, and make sure that it is divided up in that way. So yeah, we like to align where we can, but sometimes it's just not possible because of that, because of the use of the data.
Great, thanks for that,
Hopefully
Rachel. That was really clear. I can see the other Rachel's got her hand up. She wants to add to that.
Yeah, I was just going to, I'm not sure what I've done with those reactions. Just kind of jump on the back of what Rachel has said with regards to kinship care. Rachel, I'm sorry, I'm trying to get rid of all of these reactions. Nicola Turner might have something to add here as well, actually. So in terms of kinship care, the reason that the UCAS flag currently picks this up is because Scotland have asked them to. But what I should say in response to one of the questions that came up in the chat is that there is a difference between policy and data here, and the reason that we have not included it is purely based on data, because the main reason for this exercise was about making our data more robust, and we know that so we did consult on this as well. We spoke to a number of professionals that have expertise in this area and understand the journey of kinship care students. Initially, we had proposed to include this this group in the I think it was the 07 flag. We came across concern from providers about additional burden, particularly for that group, due to the difficulty in verification and understanding different scenarios. And we then went back to the table to discuss the data, and is it appropriate to have this group as part of the broader group. And I think we came to the conclusion that it could potentially skew the broader data picture just because of the nuanced differences in the characteristics in some of the subgroups. So we took a data decision not to include kinship care in the new HESA flag, because this is about local authority care. And we should also differentiate between formal, as Patricia highlighted, formal kinship care who are picked up, and informal kinship care students who aren't. So I just need to reiterate that is not our policy take. Our policy take from the OFS is that this group do share many of the same barriers to successful participation, and might have some of the same kind of support requirements as those with care experience. And we would ask providers to look at that as part of their work in supporting the students who need it the most. But in terms of the actual data, that's why we differ from Scotland, and that the UCAS flag is also slightly different.
Okay, thanks, Rachel, for adding to that. If we could just pick up, there is another question around, which I think it would be good, Nikki from UCAS, if you're able to respond on this one. Why isn't the UCAS data being adapted to capture these new data categories? I mean, it may be that it's something that will be thought about in the future, but Nikki, if you're, I'm hoping you're there, I think you're there, you're able to respond. Thanks.
Yeah, absolutely. Firstly, because the purpose of the question isn't the same as the HESA flag. I guess that's the quickest, shortest answer. It's about support. So when we first introduced the flag in, I think it was 2008, the whole purpose of that question was so the student could literally flag their circumstances to the university, just so they knew that the support was there. So it was never designed to be a data capture. We know obviously that it can be then used, and we know, although we don't officially report on our end of cycle data, it is then data that we can start to look at. And I'm actually looking at a report later this year that will contextualize it, but it always has to be caveated that this is self-declared non-verified data. So it's really about the support, and that's the really important part about it, really. Again, also, as Rachel said really, really succinctly, that Scotland, Northern Ireland and Wales are part of our remit, as well as England. So there will be differences in how we approach that anyway. So it won't map beautifully to HESA only. Equally, it won't map beautifully to SAS, it won't match, beautifully to HEFQ either, because there are those differences across the devolved administrations. And I guess also there is the question of student experience when they're going through the application. If you have a question that's really starting to delve down straight away from the moment they start to make their application, you might discourage them from starting to make that disclosure, from sharing it at that point with the university. It may actually put them off a little bit. Importantly, it can create confusion, and what we really want that question to do is to instigate a conversation and the start of the relationship between the provider and the student themselves. We don't want to sort of get in the way of that conversation, because that's where the real value starts to get added. And we know that providers don't just provide support from the moment they get to university. We know that some people help them through the application process, including making their application for bursaries, making their application to student finance, in terms of events, interviews, etc. So that, again, that's also the reason why we share that information at the point of application, not at the point of offer as well. So I know that touches on another question that was asked.
Yeah, thanks very much, Nicola. That's a really helpful summary of what sits behind the UCAS flag, as you said, as a way of identifying applicants who may need some additional support through the applications process. There are several questions relating to burden in terms of collecting the information or using these new categories. So if I just start with one of those, there's a question about, did anybody ask any students about the burden on them on providing evidence? So I don't know if either of the Rachels have any response on that particular question.
Yeah, I can start off, other Rachel, if you like. Yeah, the burden question is something that we're trying to get better at asking at HESA. But I think that asking the students and you know, staff members as well is always a really difficult one, because I think we don't have a direct relationship with students at providers, or potential applications at providers, and so we can't ask them those type of questions. We don't have that relationship in order to do that, and so we do rely on providers' judgment and providers being able to tell us whether perhaps maybe they've been able to ask students on it or staff members on something, and feeding that into us. But it is a very difficult question, because yes, it is hard for HESA to be able to do that. I mean, even providers responding to the burden question is always difficult. So I said one of the questions was about burden, and we've got kind of a matrix table to fill in on that. We're trying to develop that and make that better, because I think it's not quite working. Some providers don't like filling it in. Some providers think it could be a lot better, and I would agree with that. But yeah, burden is a hard question to answer, because it means different things to different people. And so yeah, so asking the students in this example it's not something HESA's done, and it would be great if there was a way to do it, but unfortunately, you know, we don't have that relationship ourselves.
Okay, thanks. Rachel from OFS, do you want to add anything on that?
I'll try and pick up a number of answers here. So in terms of general burden, in theory, there shouldn't really be any additional burden, because we'd be expected from the previous flags, we would have expected providers to be having a conversation with their students to understand their circumstances, and not simply sort of translating a UCAS flag into that person having care experience. We have the category is one category, but we've obviously split it into subcategories in a way to try and help kind of steer that conversation and help the person who's having the conversation to understand the differences between the different groups. And as Rachel mentioned, we did put this out to consultation. We've had a number of conversations with providers about this. You know, where there are specific issues, and I know that there are some unique to certain providers, just due to volume of students and perhaps care experienced students, I'd be interested to have you know, conversations with those providers outside of this space to see if they're, you know, what the issues are and whether there's any way around them and what's the best way to approach them. In terms of conversations with students, I have had a number myself, and I would say that responses have been mixed, for, you know, and I think we will all agree that students are not a homogenous group, and for one care experienced student might think that this is a helpful approach. Others that I have spoke to are not particularly bothered about the actual data unless it translates into, or you know, they want to know how it translates into supporting them or their peers. So that is on my radar in terms of engagement with. So I've been speaking to, we've got a few student panel members for who this is an important area, and I've been speaking to them. But we have a student engagement team that I'm looking to kind of link in with in terms of ongoing conversations with students about that conversation. I think is the thing that the issue that's coming up most here is about how to have that conversation diplomatically and constructively. So I think there is more work to be done there in terms of student consultation. And then there was a question about estrangement, which comes back down to the burden question. We are not currently asking HESA to introduce any new flags for that very reason. There are I think Will might have something to say on this, my data colleague who's here. There are existing data sources for estrangement. So I know that my data colleagues were able to link up HESA data with existing SLC data to be able to show patterns of at least retention for estranged students. So there are some data sources out there. Currently, that's not on our radar due to burden primarily, but we are working with Nicola Turner at UCAS as well to understand how we might be able to work with them and benefit from the new flags that they're looking to implement in this year, I believe. Nicola, I don't know if you've got anything to add there, but yeah, that's it from me.
Yes, just to say we're probably about a week too early before I could confirm when that question's going live, but it'll either be this cycle or next cycle. So for 2023 entry at the earliest, where we'll be able to capture estrangement in there, and we're working very closely with Standalone on obviously how that's worded, and also considering how that overlaps with informal kinship care as well. So making sure that you know, there's a real join up right across all three sort of categories, really.
Okay, thank you very much, Nicola. I just wanted to pick up because there have been several messages, as Rachel from OFS has also kind of alluded to, around how having to provide evidence could be traumatic or sort of trigger issues for people with care experience. And just to say that I think, you know, institutions already are trying to be very sensitive about how they have these conversations, and I think just to really underline for sort of wider care experience, it is very much an institutional decision if they're happy to have a conversation, and it probably would just be one conversation, because one of the things we certainly picked up from doing the feasibility study for OFS was how difficult it was for care experience students to keep having the same conversation over and over again to be able to access support. So I'm not sure that we've got a, you know, a definitive sort of solution to that, but I think institutions are genuinely very sensitive about how they approach this with students. Obviously students, it's entirely up to an individual student whether or not they choose to declare as care experienced as well. And certainly from another meeting I was at earlier today, listening to practitioners talking about how they will offer opportunities for people to declare that they are care experienced, not just once, but, you know, on an ongoing basis, and people can choose to declare later on in their university career if they choose to do so or not. So it is you know, a challenging and sensitive issue, and you know, we're certainly not trying to trivialize that in offering some suggestions for types of evidence that you might look for. Okay, I think we're probably just about coming up to the end of our hour. We're just about over, I think. So I'd just like to say a big thank you to all of the panelists today. I think it's really helped to clarify some of the rationale behind what's being done, and also the process itself. So many thanks to all of you for that. Just a few final comments from me, if we could go on to the next slide, Moira. Yeah, any feedback that you have, both on today's event or on NNECL activities more generally, do please get in touch. If your institution isn't a member of NNECL, do think about it. We've got over 80 universities and colleges in membership now. We go across the UK, and we're always interested to hear from other institutions if you want to get in touch with us about the benefits of joining us. So thank you all again very much, and wish you a very successful rest of the day. Thank you.
Thank you.